uninsured do not have the chance to primary and second level healthcare services. Together we can demand free access of everybody to the hospitals and stop the exclusion that kills. The results of these policies are tragic and are murderous. We talk about murderous policies. We know that these policies in a health system are the same all over Europe, but the contradictions are not so huge. But in Greece it's true that we have a humanistic crisis. And you can see that if you work on the health system and the patients, you can see that if you work on people without a home to stay, people that don't have food to eat. If you work in solidarity projects that have to do with these kind of things, you see the humanistic crisis. Yeah. And we consider this solidarity project we are doing as the first step of resistance, and this is our motto as well. We consider the solidarity project as a project that is changing us as well. We meet people. We see this Solidarity Clinic as a chance to meet with people in an equal level. That is why we distinguish it with charity projects. And that is why we are asking from our patients to, when they feel so, to do themselves something about this political target we have. We proved that you can have a resulting work not only if you are organized hierarchically in a pyramidal way, but in equality. The inside organization of the clinic is in two levels. The first level has to do with the different teams that are working inside the clinic. So every team has its own gathering. Pediatrists gather together and talk about their own things, about the scientific things, about the cases they see, the fact that they see many children not covered from the vaccines they should have done, because their parents don't have money to buy them the vaccines. And they see them in ages of 8 or 10 coming in the clinic to have vaccines that they should have had in the age of 2, for instance. Psychiatrists as well. Every team gathered together in order to talk and discuss about their own specific things. And also we have our General Assembly, where we meet all together and we discuss about our political work, our political targets, and some common practical things that have to do with the work in the clinic. In this general assembly, everybody is equal to each other. Everybody has an equal opinion on the political way or the political target or the political actions we want to take. So we proved that you don't have to have an hierarchical form in order to work seriously on health, for instance. And there's another way to do that. And this is, a good thing for a good political, thing that stays as a history in order to form a new NHS in the future, because now the Greek NHS almost does not exist, is destroyed from these policies. We knew very well from the beginning that we do not want to be helpful to the state, to its responsibility. And the only way we could do that is, yes, okay, offer the primary health service until the point we can, because now there's not left space for new patients to come inside. It's overfulled. Every month we fix the appointments of next month, in the end of June, for instance, we will fix the appointments of July. And the appointments are closed for the whole month in one day. So the clinic is working every day from Monday to Friday, from early in the morning until night. So we cannot offer more. And we knew that from the beginning, but our consideration was not only to offer the service, but try to make a movement, a political movement, that will be spread in the city, and not only in the city, all over the country, to ask for the right to health services. This is our first line, because we have also needed to rent one apartment close to here in order to store the medicines that cannot have here, because it's not
enough place.
left. Yeah. Two apartments. We rented two apartments close to here in order to store the medicines. Yeah. And it's very interesting that the fact that all these medicine come from the donations of people that bring the medicine, they have at home, it is not expired, and they don't need them anymore. This is a reception.
Yeah.
Obviously. Here's our dentist's room. We have two chairs that can work at the same time. Our first equipment were also donations from from dentists that, for instance, they got retired and they were closing their, jobs, and they did not need them anymore, and they said, "Do you want a chair?" And dentist's chair to offer you, and it was also very touching, because these are very expensive material.
Nice.
Today we have pediatrists. Other days it works as the psychiatrist.
Oh, good.
It depends on the program of the month. That's what I was trying to explain at the beginning, yeah. So that we have why we have toys here and yeah. The impressive thing, and I think that happened in Greece and that makes us smile, is that many clinics opened autonomous solidarity clinics, and this brought the political, the political need, not the political need, the political, motto of free health services as a political, fight. The Solidarity clinics did that. And this is a thing that history will write about. We strongly believe that if so many solidarity clinics and solidarity projects did not exist in Greece, fascism in Greece would be much more. Solidarity is an answer to the fascism. And this really makes us smile.